Hi, it's Dr. Susan Sarajari from Dominion Fertility. Thank you so much for joining me here today. I just want to talk a little bit about changes in protocol in an IVF cycle. Obviously, the goal is always to get our patients pregnant in the first IVF cycle, but sometimes that doesn't happen. IVF is not an exact science, and obviously when we prepare an IVF protocol for a patient in terms of dosages and what medications we use, we always try and tailor it to the patient's situation. But sometimes the results are unexpected and we don't get quite as many eggs or quite as many embryos or normal embryos that we want. And so sometimes when this happens, we might consider changing protocols and doing different medications or a different protocol. Now, if that happens, I don't want you to be discouraged because in a way, the first IVF cycle sometimes is like a trial run, and we actually see how your ovaries respond and what kind of embryos you make and how many eggs you make and so forth. And so it gives us a lot of information. And then in a second cycle, a lot of times we can adjust a protocol and maybe increase the stimulation medications, use a different trigger, or use different medications to prepare your ovaries for the next cycle. And then a lot of times that can give us a better response, and then maybe a bigger egg number and maybe a better embryo number. Now, sometimes we do a stimulated IVF cycle and we get a lot of eggs, but we don't get very many healthy embryos. And in these cases, sometimes then we do not necessarily change the protocol because we got a good egg yield and a good embryo yield. It's just that they were maybe not PGT normal. So trust in the process and trust your doctor. Any protocol changes we make or not will always be in your benefit. Thank you for joining me here today. It's Dr. Susan Sarajari.
Dominion Fertility, making miracles happen, one family at a time.